Kool983, South Jersey's greatest hits. It's a Kool983 morning wake up. On the phone with me right now, I've always enjoyed talking with Dr. David Feng. He is the Regional Medical Director for the Center for Vein Restoration. You've heard his commercials for New Jersey and Pennsylvania. Good morning, doctor.
Good morning. Nice to be back.
Nice to talk to you. You know, it's been a lot of craziness around. I know the case with a lot of medical practices, a lot of telehealth taking place now. What would you say the percentage of telehealth is for you right now?
As with most medical practices, we have substantially ramped up our telehealth offerings, and we probably now would be seeing 20 to 30% of our patients virtually, whether that's a simple phone call or a video conference. Fortunately, HIPAA regulations have been relaxed in this situation, allowing us to do even FaceTime, Instagram chat, whatever means necessary to get the care to the patient.
I can picture you on a FaceTime call and saying, all right, come on, let me see those legs. But that's the way you have to do it.
It really is a whole new world. We keep referring to this new normal, and that's really what it is. We're all going to have to get accustomed to a new way of living, and for us in the medical field, that means a lot of telehealth and virtual visits.
I have a feeling more people will be coming to you only because with the way things are now, with people spending more time at home, they're working from home. A lot of people are more sedentary than ever, sitting on the couch watching endless hours of television. We have to remind people, get up, walk around, be active, because if you hadn't had a problem before, because of the circumstances now, this could lead to problems.
Oh, you're absolutely right, and it's funny that you say that because I've had multiple patients over the past few weeks have said to me that their legs have given them trouble that they've never experienced before, and the reason being is because they were commuting, they were walking, they were driving, they were moving around to get where they had to be, then going to sit down in the office. Whereas now they get out of bed, they sit down at the desk, and they move up very, very little throughout the day. So I always remind people it's important to get up, stretch, walk around, even if you're on a conference telephone call, it's a good idea to maybe pace around the house while you're doing that. Just remember to get some motility and some activity in those legs to prevent early onset of vein disease.
Now, some people, they may not have symptoms that they're feeling right now, but there are things that may show themselves physically. Sometimes you're on the beach, you see spider veins. What are some things that people could self-inspect right now? And it could be the potential that you could have some sort of venous issue.
So as you mentioned, spider veins can be one of the early signs of vein disease. Beyond that, slightly larger, we call them reticular veins. Those are veins that you can actually feel. As opposed to the spider veins, which you cannot feel. But then the other end of the spectrum is the big bulging varicose veins. Some people don't see too much in their legs unless they're standing or sitting for a long period of time. Then all of a sudden one area tends to bulge a little bit, and that can be an early sign of vein disease, along with swelling. A lot of people, long periods of time standing or sitting, they notice their ankles tend to lose the profile a little bit, and that's another indication that there may be an issue with the veins in the legs.
Dr. David Feng, Center for Vein Restoration, 1015 New Road. Phone number, David?
The general number is 1-800-349-5347. Northfield, the direct line to our office is 609-677-6030.
Okay, and hours of operation?
We're in Northfield on Fridays during this scaled-down pandemic from 8 a.m. to 6 p.m. But our regular schedule, when things get back to a normal world, our regular schedule is Wednesdays and Fridays in Northfield.
Thank you very much, Dr. Feng. Stay safe, and our fingers crossed that we'll get through this sooner rather than later, and you'll be back to having a full waiting room.
The light is always on at Center for Vein Restoration. We like to provide a safe alternative to the emergency room for patients that may have leg emergencies.
Great. Thank you so much.
Thank you very much.
Dr. David Feng for the Center for Vein Restoration.